Good morning, good afternoon, good evening from wherever you're joining us. Welcome to International Medical Corps' Fall Update. Today, we're going to pull back the curtain a bit and reveal some of the behind-the-scenes work that goes into humanitarian response. I'm Rebecca Milner, International Medical Corps' Chief Advancement Officer, and I'm happy that you've joined us today. Thank you for taking the time and for all your support of International Medical Corps. Your generous donations make our work possible, so thank you. Thank you very much. Today's session is going to be about 45 minutes long. And as we talk, please type your questions into the Zoom Q&A and we will try to get to them. If they aren't covered during our time today, we will follow up with you. So when people think of humanitarian response, they often envision what could be considered as the tip of the iceberg, really. That is the doctors, nurses, and other health experts who provide direct care to people affected by conflict, disaster, and disease. But like an iceberg, there is far more below the surface when it comes to humanitarian response than what is immediately visible. International Medical Corps, as many of you know, has been responding to crises around the world for more than 4 decades. And it's really no accident that when we deploy a team to a crisis zone, we always include experts in logistics. It takes a lot of work and expertise to move medicine supplies and equipment across borders, conflict zones, and disaster sites. Our expert logisticians work around the clock to overcome many challenges that range from custom delays to damaged roads, all to ensure that the right people and supplies make it to the right place at the right time. And partnerships with supporters like you and with private companies make this possible. One partner that's been integral to our success has been Flexport.org. Flexport has supported our response efforts since 2020, providing key logistics support in 13 countries, from the COVID-19 pandemic here in the US to the wars in Gaza, Sudan, and Ukraine. Our partnership has been so successful, in fact, that we will be presenting Flexport.org with our Global Citizen Award at this year's annual award celebration, which we are holding just 1 week from tomorrow, November 13th, here in Los Angeles. Today, we're honored to be joined by Dave Hartman, Flexport's Senior Program Manager for Global Aid. Dave will discuss humanitarian assistance through the lens of the private sector and why it is important for his company and what they look for in a partner. I'm also happy to be joined by Ronny Elfassy, our Senior Director for Global Logistics and Supply Chain. Ronny's years of experience in humanitarian work as a logistics and operations specialist make him uniquely qualified to talk about the critical role of logistics and of public-private partnerships in humanitarian assistance. So welcome to you both. Thanks for joining us. Ronny, I'm gonna start with you. Our relationship with Flexport.org began in 2020 during those early dark days of the COVID pandemic when everyone was struggling with supply chain issues. Can you talk a little bit about how the challenges we were facing back then, and how Flexport.org helped us solve them?
Sure. Thanks, Rebecca, and thanks for having me. I think that, often we hear logisticians talk about how the world of supply chain changed. And I remember people talking about that pretty much ever since COVID. And, what we were seeing in those days is that this was a new thing to happen. It was new for everyone, all of us in the business. Things were changing on a daily, sometimes hourly basis. There were massive price surges, both in freight and for supplies. So we saw freight costs shoot up. We saw pricing for PPE change just on a regular basis. And another thing that we saw was regulations changing from country to country when we were trying to import and export things. And so, a global crisis like that means that you're working across various time zones, and you're potentially in countries that you don't have experience in. So, for example, we were procuring and exporting from China, something that we hadn't done before, but it was basically, it became at some point it became like one of the only
The
places you could
only.
get PPE. I mean, I remember our global procurement team, I think they had launched over 200 RFQs. Every time they got to the point of purchasing PPE, basically, they would sell it to the next highest bidder. And it was so difficult to get our hands on supplies. And so, you know, those days, Flexport kind of came into the picture and partnered with us. One incredible partnership that we had was they covered the cost of shipping over 2 million units of PPE from China to LA. And then we then used that PPE to distribute to 40 hospitals, 20 hospitals and 40 different clinics around the US. And so that was incredible. And what that also did was that gave us, because they donated the shipment for free. So what that gave us additional resources that we used to then purchase another 250K worth of medical gear. And that went a long way. I mean, I remember those days because we were setting up these additional hospital units in hospital parking lots. And I remember having my AirPod at one ear interviewing staff as I'm setting up hospitals. My interview was very simple. You know, are you are you are
Are you
you
ready?
are you
Are you
able to
ready?
do this? Are you willing? Okay, you're hired. Let's go. So that just tells you like how chaotic that was, and really, I mean, Flexport coming into the picture and helping us with that, providing for the first time for us transparency and real-time shipment tracking. We hadn't had that before. And things like when I spoke about the changing regulations, there was a point where we were exporting PPE from China where they had changed the regulations while we were getting the supplies ready to export. And Flexport picked up on that, and they were able to alert us before basically. Oftentimes things like this happen, and then your supplies get to the port and they're stuck, and you don't know what to do, and you're chasing your tail. And Flexport alerted us to this ahead of time. We were able to change the documents. We were able to do what was necessary to get the stuff out there. And it wasn't just for our response in the US, but also, I mean, we had PPE pre-positioned in Dubai that went then to all of our different country missions around the world. So incredibly helpful.
Yeah. Well, Dave, I mean, sort of a two-part question for you. I mean, please, from your perspective, share your thoughts about the beginning of our partnership during COVID, and then transitioning from there quickly on the heels of COVID, talk about our joint response to Russia's invasion of Ukraine in 2022. I mean, this was a very important response to flexport.org. And, maybe you could talk about both COVID and Ukraine.
Sure. No, and I think Ronnie hit really touched on a lot of the different points that come to mind for me is number one, sort of the global scale of both of our organizations and sort of that global view. As Ronnie mentioned, one of the key things that was a benefit for us or an asset for us is we do have really strong teams in Asia. And so when there were these changing regulations, those teams were all over it. The whole Flexport community was fully focused on how can we help, stem the tide of COVID. And so we had really great folks in China who were sort of monitoring those regulations and assisting us in making sure from the Flexport side that we could do what needed to get done to get PPE out and quickly into areas that it was needed most, right? And so to me, that was number one, sort of the global nature. We shifted pretty quickly from where we were delivering PPE with y'all. And then two was sort of just the speed and the adaptability. And so when we did start to get a PPE into the US in a large way, we then pivoted to supporting deliveries within the US to the smaller hospitals and clinics that you were working with, right? And so from there, we sort of switched from these big air movements to these much, much smaller trucking movements. And same thing, we just built a lot of trust in a really quick amount of time, which again, I think goes back to values alignment and understanding that we're both working towards a common goal here, which is humanitarian impact. And sort of the ways that we do that are different. Y'all focus on the medical side and sort of implementing really great medical programs. For us, it's logistics and saying how can we serve the humanitarian community. So chaos is definitely a word that fits there, Ronnie. And I think we, as logisticians, our job is to figure out how do you control it, and how do you get clarity within that chaos and figure out what are those important things that we need to do and what do we ultimately need to do to just get this aid to where it needs to go. So really great alignment there. And I think that translates perfectly over to the work that we did together in Ukraine. This
Mhm.
was one that um, again, we had at that point, we'd been working together pretty closely for about 2, 3 years. And this was an opportunity for us to really focus on a particular country and operate at scale. There were a lot of different things that were going on there. There were complex supply chains, so issues at the borders and getting cargo into Ukraine. And so we were really adaptable and pivoted. When there was a lot of congestion on the Polish border, we decided to move via other borders and go that way just because figured the fastest pipeline here is what's
Right.
needed because your team's medical teams need these items now. Um,
Mhm.
and that also shows too the really high quality or the really long-term commitment that we both have. And so we're still partnering on shipments to Ukraine, right? So International Medical Corps hasn't walked away from Ukraine, does have really long-term, really high quality programs that continue to this day, and Flexport is still committed as well. So sort of that desire to play the long game and really make sure that we're there for communities for the long haul, I think is something that's unique. And we also, again, the global nature of Flexport really stepped in there. It was really an asset there because we have really high quality teams throughout Europe who were very close to the conflict. Some people were of Ukrainian descent or had family in Ukraine, and so they had a really strong personal motivation to be involved. So for us
Mhm.
as a company, it's just really, really important for us to be able to give back to communities wherever they are, whenever disaster strikes, because we probably have somebody who has a relationship to that community in one way or another. And if we don't, well, there's still people in need. So I think that's something that
Right.
align really well with IMC there.
Right. And so Flexport is a private company. And then you fund the work that Flexport.org does for the humanitarian community. Is that correct?
Yeah, so
As a
effectively,
company?
yeah, effectively, flexport.org, we're not our own independent nonprofit or anything like that. We're a business unit within Flexport. Um,
Okay.
and we've raised private money from sort of the investors of our company and board members and things of that nature and employees that we can then use to offset these costs of these shipments because it's expensive to move cargo around the world.
Right.
These planes that Ronnie's talking about, they can cost $500,000 to move, and we have to go pay the airline, pay the truckers involved, pay in some countries have to pay customs duties and things of that nature. So there's a lot of hard cost that we have to do. So yeah, so we
Right.
go out, we raise money, and that way we can apply that to shipments when International Medical Corps or other humanitarian organizations come to us and say, we have urgent shipments and we don't possibly have the funding for this. We can step in and say, great, we'll cover the cost of those shipments. And that way, as Ronnie said, you can then go buy more medical supplies, hire more staff, whatever it may be. It's just a huge multiplier effect because, as you know, donors are often they're eager to pay for the commodity, or maybe they'll donate the commodity. That little very
Shipping
important,
is.
but it's a very important but very expensive middle leg. It's not the coolest thing to fund necessarily, unless of
Mhm.
course you're a transportation company. Then we think it's the coolest possible thing you could cover the cost of. We're freight
Right.
nerds here. We love it, but we're also humanitarian nerds. So getting to combine those two things is just a really great opportunity for us.
Wow. I mean, it's really a tribute to your company that this is just such a core value, and that you are giving back, and how it relates to your core competencies as well. So really kudos to you and the team for that. Ronnie, one of the things that constantly amazes me and all of us about the logistics aspect of our work is kind of how many moving parts there are, right? It's just incredibly complicated, especially when you consider the difficult and sometimes dangerous environments that our staff is working in. And I imagine sometimes, some of these challenges can get pretty frustrating. But could you talk a little bit about the complexities that you and your team face in your everyday jobs and how partnerships like the one that we have with flexport.org help us kind of simplify and streamline our processes, making us more efficient, essentially?
Yeah, sure. Yeah, it's incredibly complex, can be incredibly frustrating,
Mhm.
and there are just so many pieces that can go wrong. That's the thing. And when something goes wrong in logistics, then everyone notices it. That's when you shine. Uh, So, but yeah, I mean, the multiple moving parts. If you look at the kind of the cycle of procurement, you're working with a supplier, sometimes multiple suppliers to get the goods, prepare the goods, and then arranging pickup. So then you're working with a freight forwarder as well. And oftentimes for us, we're working with a freight forwarder separately than working with the supplier. Um, Sometimes it can be multiple freight forwarders as well, or a freight forwarder is working with different carriers and they have different, methods of working together. And then, you get into customs. Customs is very difficult. You're looking at working with customs brokers and customs authorities. And what I've noticed recently, maybe not recently, but it's for us in the countries that we work in, it's just that maybe getting more and more difficult is that you're also working with different government ministries, and sometimes you have to just you have to get approval from over 5 different ministries just for one shipment to get imported into one country. And then, once the supplies get there and hopefully they haven't gotten stuck at port, then you're dealing with last mile delivery teams. And you're in the field, things can change rapidly there. So from the moment that you've started the procurement to the moment that it's actually there on the ground, so many things can change, and you have to be able to, number one, have a good relationship with these partners that you're working with, and be able to pivot fast when things change. The other thing that we're dealing with is unpredictable demand, and we have sudden surges in demand. If you look at disease outbreaks or natural disasters, I mean, even with conflict, oftentimes these can be protracted and you can kind of see them coming. But we're seeing more and more now with conflict situations where things change rapidly, and so then all of a sudden access changes or borders change, stuff like that, that you then need to kind of work with. And so you've got limited infrastructure on the ground. You've got different regulations that you're trying to work with. And then the third one it's a big challenge is information management. For us, for me, I really think that one of the most important things in our job is how we manage information. And we have massive visibility challenges when it comes to procurement and freight. So tracking our shipments in real time is critical, and having delays in tracking, so those shipments causes delays in the shipments themselves. When you don't get an update that something happened to a shipment on time, that often will cause delays in the shipment because you haven't resolved the bottleneck ahead of time. And sometimes that can cause things to get stuck. So you're really talking about, I mean, if we're talking about saving lives, that makes a difference in saving lives.
Right, right.
And sometimes it can be too late, when you don't have the proper information at the time that you need it and something gets stuck, it's a lot harder to deal with it when it's at that stage than to deal with it before, like before it leaves or when it's en route. So information management is really critical. And with working with Flexport, where they stepped in is they provide that end-to-end visibility on our shipments. So they're giving us consolidated shipment data. We can see where things are moving along the line, whether it's trucking being picked up from warehouses or getting on a plane or getting on a boat. And they're constantly, like Dave was mentioning, they're constantly looking at all these data points and what's happening around the world or along the points of your shipment, and automatically updating it. So, we've had times where we've gotten updates from Flexport just from using their tracking system before, let's say, the carrier knew that something was happening. And that gave us a huge amount of power to be able to solve problems as they came up. Another thing is that oftentimes what I'm used to in logistics and supply chain is a thread of about 100 emails where you're talking to different freight forwarders, different, all these people that I had mentioned before. And what was really great when we started using Flexport is that all of that moved to the platform. Very intuitive, very easy to use, and also for other stakeholders, other departments at IMC that wanted to get updates, they're easily able to log in or even get automatic updates to their emails, as opposed to these constant back and forth and manual emails that really take a lot of time. If you have a team that's responding to an emergency in the field, having to update all of that manually is a significant amount of work. And so this removes a lot of that, reduces a ton of emails. It provides the specialized expertise, like Dave was saying. So expertise in freight, in customs, in how to ship certain items like dangerous goods. Flexport was able to help us navigate these situations and become a force multiplier. And I think something that I was speaking to my team, and our global procurement team was mentioning around the time of COVID that um, if if we didn't have that, then we would have had to hire a whole team that was dedicated only to that, only to those procurements and those shipments. But because you're working with Flexport, it kind of becomes an extension of your own team. You have more logisticians on board now that you can utilize.
Right.
I mean, that's amazing. So yeah, having those dedicated account managers, having that specialized expertise really helped us reduce all of the friction and any kind of failure points that we might have.
Yeah, and just as a follow-up, I mean, does the fact that a lot of our supplies are pharmaceuticals, that just adds a layer of complexity, right? I
Oh
mean,
yeah.
because those have to be treated uh, in many special ways, right? And you know, talk a little bit about some of that, those
Sure, yeah.
challenges. Yeah.
So with pharmaceuticals, you have a few different challenges. One is, of course, temperature control. And so you have the challenge of temperature control across a different range of pharmaceuticals, where some might need a different type of temperature control than others. We saw with COVID, the ultra cold chain, where people really became aware of the struggles of cold chain shipments.
Right.
And so and that also this is it's also information management, right? It's how do you track the data for your shipment and make sure that it gets there and that it's safe to use.
Use.
The different documentation that you need to clear import for pharmaceuticals is also, it's a whole other ballgame than just shipping regular supplies. And then when you get into medical equipment, then you also get into additional layers of complexity like dangerous goods and how do you ship all of that? All of the stuff that we're using with lithium batteries in our medical equipment, that becomes difficult. And
Mm.
Flexport's team actually gave us training at some point, the dangerous good awareness training. This is just one part of their specialized expertise that they were able to share with us and help us navigate all of this complexity.
Yeah, amazing. Well, Dave, we've talked a little bit about what Flexport brings to the table and how you're able to help our operations become more efficient and effective. I mean, let's kind of flip the script there a little bit and ask what makes International Medical Corps an attractive partner for flexport.org? What do we bring to the table that you haven't seen elsewhere?
Sure. And I think the foundation of it is just our commitment to your commitment, obviously, to humanitarian impact, right? And just sort of being a blue ribbon, five-star, whatever accolade you want to use, just a really premier organization, providing medical response, medical care to folks in the hardest to reach areas. That is just like, that's the partner we want to work with. And then I think Ronnie hit on a number of those things. Problem solving, I think that is something that it's inevitable as a logistician. Like that is what we do. There wouldn't really be much of a job if there weren't problems in logistics. The hard shipments are the ones that honestly are the most fun and the most rewarding, is sort of those complex routings and figuring out how do we get this to that area where nobody else can go, where only IMC's teams are able to operate. So that sort of commitment there is always nice. It's good to just know that the folks on the other side of the table, on the other side of the screen, also are just the end game is like, let's get this cargo delivered and get it to the hands of the doctors and the folks in need. So that's a really component there. And then just, you hear, listen to Ronnie speak, it's, the logistics knowledge and sort of understanding and sort of the trust to sort of not outsource, but to let Flexport sort of provide guidance and expertise on certain components of supply chain, while still having like a very, very, very deep source of knowledge across all of your teams, but then saying there's going to be components that just we're not a logistics company, let's rely on Flexport. And then I think the tech, sort of your embrace of technology, is really different. Sort of your team's appetite for not just great Flexport as a platform, but what else can we do with this? Is there additional reporting and data that you all have that we can have insight into? Connecting, and so you've connected PIMS, which is of the Pharmaceutical Information Management System, which basically helps give visibility into where all of the medical supplies, the pharmaceutical supplies are globally. And that's connected to the Flexport platform now. So you can see from the supplier pickup at the factory in Belgium all the way to delivery and actually distribution of those items. You have visibility into that. And that's something that I think is very unique, not just in the nonprofit sector, but just in any logistician and any at any company or organization, to really understand that having more visibility gives you the ability to just be more strategic, and to really
Mhm.
really empower folks down at the field level and back at the global headquarters level to make decisions together with really insightful and informed data, and not sort of just be guessing or shooting in the dark. So a few
Right.
key things there, that I think just make for a really great partnership, that we have benefited frankly as much as y'all have.
Oh, that's great. Well, Ronnie, we have one of our attendees has asked a little bit about um, local procurement. I mean, we've talked about some of these big global procurements that we are involved in, but local procurement is also a priority for us. And maybe you could talk a little bit about that, right? Because the question is, does that reduce some of the friction, and some of the complexity?
Yeah, definitely. And it's a big focus of ours. We want to hear from our field teams on the different market surveys that they're doing. We want to empower them to be able to procure locally because that saves a ton of time and a ton of, these kind of situations. It can be challenging as a medical healthcare provider to source quality items that pass kind of um, our criteria for
Right, for
what we call like pre-qualifying a medical vendor, and not just us, but donors as well, right? So we're working in a landscape where different donors have different requirements, but for us, I mean, we always want to be up there with the most strict requirement to make sure that it aligns with the highest standards of quality. And so we do a lot of work on that. We actually often try to if we find a vendor that has capacity that we could potentially help bring them up to the level that we require or that other donors require, then we try to work with them to get them there. And it's not just us, many NGOs are kind of trying to focus on this. There's organizations that their sole focus is kind of trying to develop this market. But for us, it's
kind
that
of a
quality
balance, right?
aspect.
It's
Yeah,
right. It's a
we have to
balance, right?
balance it
Speed, quality, all of those things we
Sure.
have to kind of consider.
I'd
for
weigh in there
sure.
too, with having visibility, but our software providing visibility and us tracking the shipments, is we do see things going every which way. See things coming from East Asia to the Middle East. We see things that are going from Europe to Sub-Saharan Africa, intra-Africa moves. So there really is when I see a new shipment pop up for International Medical Corps, I don't know where it's going to be going from or to,
Right.
which is always interesting to deal with. But like you really couldn't predict, where's this going to start and end. There is not there's some major hubs, obviously, but I will say like the network that y'all have built is quite impressive. And for us, again, it's from a geeky freight standpoint, it's just fun to sort of see that supply chains that you have built and sort of how you move commodities around the world.
Yeah.
Yeah, it's interesting. Our suppliers are also understanding this more and more. We have suppliers that typically have their warehousing only in the Netherlands that are now expanding and making sure that they have enough capacity in Dubai as well as another hub to get supplies closer to where they need to be. We have suppliers that we work with their distributors in certain countries, and we work on these agreements where we that they certify that the supplies they got was from that supplier that we have a contract with in Europe. And so there's all these ways that we try to kind of bridge that gap. But what remains is that the type of aid that we give requires high quality standards and requires supplies. That's something that some NGOs might work with. That's, for example, distribution of NFIs, where they potentially could switch to distribution of cash. Whereas when we're dealing with healthcare, we always will need supplies. And so that's something that won't change.
Right, right. Well, and we've really kind of touched on a lot of the high profile responses, right? But then, of course, there's all of the kind of complicated, under-resourced responses that we're working in places like Central African Republic, the Democratic Republic of Congo, maybe Yemen. Maybe you could talk a little bit about some of the common issues that we've come across in these responses and what challenges you may have encountered recently that are perhaps found only in certain countries or certain operating environments. I mean, I don't know, Ronny, if you want to start, and then Dave, you could talk a little bit too.
Sure. Yeah. I feel like we've been saying for years now that we see increasingly complex responses coming up, and at some point it's becoming a big portfolio of our country missions. But these are very difficult environments to work in, and I think some of the main constraints that I see in these specific types of countries. Number one, the access and security is a major issue. So restricted movement, border closures. You look, for example, at our Gaza response. You at any given day you can log on to the different maps that are available that show which borders are open or which borders are closed, and it's constantly changing. So when NGOs are trying to bring supplies in from Europe or Egypt or Jordan or the West Bank or Israel, every different border at any given time might have different issues going on with it. And so it's very hard to have a supply chain strategy when things are constantly changing like that. And the other thing is we spoke a bit about infrastructure gaps. So you have poor roads, limited warehousing, limited cold chain options in some of these countries. I remember in Sudan, when we were responding to the conflict there was a point in time where Port Sudan had lost its power, and so it stopped being able to receive cold chain ocean freights to the port because it just couldn't guarantee that I could keep those containers that are the refrigerated containers. It couldn't keep them cold for long enough by the time the time it takes to clear customs and get the stuff offloaded and everything. And so it basically, at that port, they were basically not accepting cold chain anymore for a while. I can't remember how long it was, but we just had to pivot everything because we had a bunch of shipments underway. Looking at, for example, DRC, you have different regulations or different authorities that you're dealing with, whether you're dealing with the east of DRC or the west. Yemen, we saw ports being closed recently in Yemen due to different political change, environments changing in the politics there. So very complex, constantly things that are changing. A lot of these countries require these multimodal shipments, so you could have, you need air freight and trucking. Great, but some of them require you have to move your supplies on a boat in a river.
Right.
I mean, there's just every possible way to get your
Pack
supplies there.
animals, right? Pack
Donkeys
animals.
with carts,
Right,
yeah. Another interesting one with Sudan was that as we respond to the conflict there and try to get our goods in from Port Sudan in the east over to Darfur in the west, there is no access. This is the same thing as in Gaza. If you get your supplies into the north of Gaza, you're unable to get those to the middle or the south areas. And so in Sudan, we've had to kind of get creative, and so we bring supplies in through Chad. We do have some projects going on in Chad where we respond. We're supporting communities in the north of Chad, and then we're also bringing supplies in through that border into the west of Sudan, where we're able to get supplies in. that took a while. It was very difficult to do. Um, and then the other thing that I see in these responses, and you alluded to this, is the funding constraints, right? So these are under-resourced emergencies, where it's difficult for us to raise the proper funds that we need to ship supplies. So we often get donors that come to us that say, we have these supplies to donate to you for, let's say, Sudan or for whichever emergency, but then we need to get it there. And that's where things
Right.
can get
And
stuck if
that's
you don't
when
have the
it can
funds
get
for it.
really expensive, right? That's where it can get really expensive.
Exactly. Yeah. And so Flexport, for example, have helped us um, with with the shipments, getting those donated, what we call gift in kinds, getting us those donated supplies to the countries where we're responding. And I think I saw last year, 2024, Flexport supported over 20 GIK shipments, so shipments of these donated supplies, which I don't know that we would necessarily have been able to accept those donations otherwise. So that was a major help in these different contexts.
Right. So Dave, from a private sector perspective, what are some of the common complications that you see in these
Yeah,
really tough places?
sure. I mean, Ronnie had touched on a number of them. I think access is one, and this is both just safe to access, but just also not even conflict necessarily, but port closures due to or infrastructure damage due to weather impacts and storms, right? And so those are things that we need to do, and just poor road conditions. And again, as Ronnie said, this is physical cargo we need to move. There isn't really an alternative other than to figure out how do we physically get this into that area. Um, and then just the regulatory environment that's constantly changing. Sort of what we need to do to abide by, U.S. and EU compliance standards, but also with the local compliance standards in whatever country we may need to be, and where we're trying to get the cargo, and then speed. And trying to actually deliver this freight quickly, and get it into the hands of the people that need it the most. And so all of that's a balancing act. And I think it's really the complexity comes from trying to do sufficient diligence, do enough planning, but also not over planning and over engineering, because you have to understand that things are going to change. And ultimately, like the best laid plans, if the cargo doesn't move, it doesn't really help anybody. And that's what we need to do, is make sure that the supplies are actually getting to where they need to go. So really figuring out what that balance is and what that happy medium is, and then being really adaptable in the moment, which again comes back to the problem solving that we discussed, and saying like things probably going to go wrong maybe 30%, 20%, 50% of the way through the shipment. And that's when Ronnie and I need to work with the local teams, to work with our experts at Flexport to figure out what do we do to problem solve. So
Right.
really just like balance, I think is that. And a lot of that comes down to the long-standing relationship that we do have, because we're both able to anticipate sort of how the other party is thinking, and sort of what their primary concern is going to be, which just allows us to be on the same page, to speak the same language, and to operate really quickly and effectively.
Right. All hallmarks of a
Yeah,
strong partnership. Really
certainly.
awesome. Awesome. Yeah. Well, we just have a few minutes left, and we always want to end on a real positive note, right? I mean, we are able to deliver and together. But also things are changing so quickly, and there's a lot of exciting new developments that are happening. So maybe from a future looking perspective, what are you excited about? What are the most exciting developments that are on the horizon? Um, Dave, do you want to start?
Yeah, sure. I think this might be a little cop out in an answer, but I think we don't know what it's going to be yet. And I think that's sort of
Hmm.
what the partnership has shown is, um, whether that is a major response where we partner, in a really unique way together, or some of the logistics innovations that we've done. We've had instances where Flexport, where one of your donors for IMC needed to get the cargo out of their warehouse very quickly, and so Flexport stepped in, found some warehousing capacity, and was able to hold on to it while the regulatory requirements being filled at the country destination. Not something that we had planned to do. Same thing, sort of the integrations that we've done on the tech side. That wasn't something at all that was sort of being discussed when we first started moving PPE during COVID. So I think one of the exciting parts about both this industry and also just these types of partnerships is we can't really predict what's going to be next. We just know that if we have good partnership and we're sort of open, communicating and working hard and sharing the issues that we're dealing with, we're able to surface problems and then figure out solutions to them. So, not a true answer there, but I think that's sort of like the, next time we talk in another 6 months or a year, we'll be able to present on here's something neat that we've done recently.
Right. Yeah. Well, what do you think, Ronnie? What are you excited about?
Yeah. Maybe I'm trying to think if I do know what's coming. I think, well, first of all, I think we talk a lot about the different innovation, the technical innovation that's taking place in our industry and in this field. What's really cool is that there's people behind that are very excited about what they do. Dave, you were mentioning I think you mentioned that it was fun, or the challenges are the fun part. And I agree. I think that there's some of us logisticians that love the challenge of getting supplies from point A to point B. And then there's others that just love the challenge of procurement, of engaging with suppliers. And so for me, like working with my team, we're all those kind of individuals that love solving these challenges. We'll get on calls, we'll just brainstorm things that are happening. Everyone's kind of in it together to try and help other people that are having problems in other countries. And what we're seeing now with the humanitarian landscape is that we're trying to figure out how we can do more with less. And so the two ways that I see doing that, or maybe three, number one is this digital transformation of humanitarian logistics, where we really integrate all of the parts of what we do in the supply chain. And so Dave had mentioned our work with our pharmaceutical information management system, where that system really was designed to kind of manage a pharmacy at the last mile, at the distribution point where pharmaceuticals are going to the hand of the communities that we work in. But really what we've been able to do is develop it and integrate it to all parts of the supply chain all the way up to freight and stock management, and then freight and procurement. And even in our when we do planning for proposals, we use that system because it has the data that we need to understand if we're going to respond to this type of disease, this is typically what we use, this is what we would need. And so I'm very excited about that transformation, having everything kind of integrated. The partnerships that we have with these types of the private sector and these types of companies like Flexport that are forward looking. I mean, I think a lot of us in logistics are used to these really kind of old, archaic systems and ways of communicating, because everyone wanted to basically cater to the lowest common denominator. If you're dealing with all of these different countries and different ports, and some of them use fax, like you're always trying to use the lowest barrier technology that everyone can work together on. But working with Flexport, I think they see it a little bit differently, which is that we can use innovative tech in ways that is still helpful down the line to our field teams. And then the last one there is, so doing more with less is also about our teams. And so how do we elevate the staff on our teams that can do more, that want to do more, that want to be more kind of higher level, more strategic thinking? How do we bring them into the picture and hear from them, and also from our country missions in the field? Every time we have our logistics monthly meeting, then I ask the team, if you see anywhere where we can innovate, where there's something that we're doing that is inefficient, please let me know, message me, so that we can work on it together. So getting that information from our teams is really critical.
Yeah. Well, one thing that struck me about this conversation is how aligned with the International Medical Corps' mission our logistics work is, because you are not only delivering humanitarian assistance, but you are also training and strengthening the capacity of not only our own staff, But I thought it was fascinating that you mentioned that you're working with vendors and private companies to make sure that their supplies and medicines are upgraded enough to be part of this market. And I think that that just speaks to International Medical Corps' kind of core belief in, the fact that we have to deliver, but we also have to strengthen capacity at every level to be more effective and efficient. So what an awesome, interesting conversation, fascinating work, really, when people think about treating a cholera patient or treating someone who has Ebola or someone who's got a blast injury from a conflict or, it's been, has a upper respiratory illness because of the floods or everything. I mean, it's just all part of it. And this is such a critical component of the work. And I just, I'm so impressed with both our logs team and our private sector partners that help us deliver on this. And so just, want to thank you for that. And thank our participants today. Appreciate you spending this 45 minutes with us. We look forward to seeing you on our next set of calls. And, thank you so much for joining us. Really appreciate it. We'll sign off. Thanks, everybody.